Okay, hello, and welcome to this eSchool News webinar, Telehealth, Keeping Classrooms Safe and Students Emotionally and Physically Healthy During and After the Pandemic. My name is Kevin Hogan. I am the editor-at-large for eSchool News, and I'm excited to have you join us for what should be a very informative session. Today's webinar is sponsored by Hazel Health. Hazel provides telehealth services specifically developed for schools to expand student health services, including urgent physical health and behavior health for students and their families. The Hazel Care Team is available for a visit from the school health center or at home in just a few taps. With immediate medical care at school, students have fewer sick days and parents miss less work. Hazel provides families with referrals, resources, and the follow-up to ensure healthy outcomes. With me today are a panel of EdTech industry veterans that I know will provide some great insights into this topic. Be sure to participate in this webinar by asking questions using the Q&A tool below at the bottom part of the screen. I'm sure everyone's pretty savvy in Zoom by now, so please just have at it. So with me today, starting with Dr. Rob Darzynkevich, Chief Medical Officer at Hazel Health. Rob has over 13 years of ER experience, the last 2 as the Pediatric Emergency Director. He believes that technology can improve healthcare access and quality for students and their families. Also with us today, Renee Kotsopoulos. Renee has been a registered nurse for over 31 years. 20 of those have been with the Garland Independent School District, the last 4 as Director of Health Services. Before coming to GISD, she worked at Medical City as a charge nurse on a medical surgical floor, as well as disease and case manager for Blue Cross and Blue Shield. Also with us today, Colleen Williams. She is the Director of Student Wellness and Student Services. Colleen has been with her district since 2003. Her goal is to refine the wellness multi-tiered system of support to include proactive and responsive social, emotional, physical, and mental health services and interventions to address the needs of all students. Allowing students to experience welcoming, safe, and inclusive learning environments where they can thrive and learn the skills to be successful community members in their personal and professional lives. So as I mentioned, 3 folks here who have spent their careers and devoted their lives to helping students social, emotional learning, as well as physical, their own physical health. So I think it's really going to we're going to get some really good insights today. Starting with Dr. Rob. Dr. Rob, maybe you can talk a little bit about your experiences in terms of telehealth, not just the physical health. I know in the past year, as I've been covering the pandemic and the advent of COVID-19, the rush to telehealth services was not only just a luxury or kind of a novelty to have, but it became a really kind of stark reality. And both on the industry side and the district side, the number one priority, it seems, has been to just kind of keep students safe. Maybe you can talk a little bit about your journey with Hazel, even, BP before the pandemic, and now here we are, unfortunately, during the pandemic.
Yeah, no, thank you, Kevin, and thank you everyone for your time today. Many children either lack insurance or they lack access. I mean, they live in medically underserved areas where they're really not getting the care. Just like food deserts, there are medical deserts, and children really don't get the access. As an emergency physician, where do they come? They come to the ER, where they lack a medical home and truly lack the care that they need. Next slide, please. And so really, I'm grateful for my education. I believe it's given me what success is, but I also know that a child who is not healthy is a child who cannot learn. And studies have shown that children who are chronically absent have a greater risk of getting out of school, failing and not completing high school, and actually have been linked to worse health outcomes. And even studies have shown also that an education is direct correlation to lifespan and overall health. And as we know, in the medical world, as we are all learning of social determinants of health, that children who have so many barriers to care, groups that are marginalized, there are so many different barriers to these children to stay healthy and succeed. We really dove into this, and this was a passion of mine coming to Hazel when we first started. Next slide. And so that's our goal, is really, people ask us, are you a technology company, telehealth? And really we're here to just leverage technology, really see what technologies we can deliver the best high quality health, and also improve that and show the outcomes, as well as delivering empathetic care to our families. As we understand with adverse child experiences, social emotional learning, there is so much that not just physically goes into a child's well-being, but as well as their overall wellness. And so in finding great partnerships in communication and with our partners here today, I'm really excited to talk about those things. Next slide. And really, this is our mission, and really, what we say, that really, truly have seen how we can transform lives by ensuring all children have that access to quality health care. Thank you.
Rob, thanks very much. Talk a little bit about this transition. I mean, just this unique time in history where we are from when you started with Hazel Health. I'll assume that you're a very forward-thinking individual. Maybe a pandemic was not necessarily part of the equation when you thought about this solution, but it really has been something that is hugely important. As I mentioned, it's not just a nice to have; it's become essential, right? Can you talk a little bit about that journey into where we are right now when it comes to telehealth?
Oh, without a doubt. I think, as you mentioned earlier, Kevin, in telehealth, we think of before the pandemic, of I just, punch in my credit card, I can see a clinician, it's really convenient, it's direct to consumer, and that has its benefits, and it's been shown to have benefits for sure. And as we exploded with this pandemic, to know that it's not just a certain part of the population that could benefit, but everyone. The question is how can we reach? And I think access is truly the word of choice. And knowing that to have such great school partners who have done this, they've found hunger, they found mental health, they found physical health, working with that partnership to really reach families, to build that trust, to help build that access, I think was probably one of the biggest aha moments that we had for success for our families.
Yeah. Now, I think a lot of people might see this solution as something that might be only for districts that are wealthy or have a robust IT infrastructure, or who are really just kind of advanced or innovative. In some of my conversations, so there is a very interesting aspect to this where it can help all districts, that it's not necessarily just the richest district when it comes to digital equity and getting student access to doctors in a more broad sense. Can you talk to that a little bit?
Yeah, I think, it's as a clinician, the best thing I can do is listen. And I think that's 100% listening to our partners, listening to schools. And I had a conversation with a nurse who had a lot of the things that you mentioned. And so I just said, what do you need? And her answer was, we need behavioral health. We need to get more access to these kids to get these issues. These are our problems. And that's where we can do is listen and innovate. And I said, we talk about leveraging technology, and that's the goal is like, how do we really get access for those children when they need it at the moment, so they can actually return to class feeling better, but in the moment address that issue, but more importantly, continue their care, get them success, and prove that success.
Yeah. Another two phrases which I have found that permeates the conversation now because of the pandemic is the idea of synchronous and asynchronous. And so far as we've been talking, I mean, I have a day-to-day image of, student has a problem, telehealth, you get on, you talk to the doctor, there are a lot of advantages to that. There are a lot of asynchronous elements, especially when it comes to healthcare and for students in terms of forms processing, data privacy, getting approvals, a lot of the boring sort of drudgery. Talk a little bit about how Hazel Health addresses that kind of back end of things beyond just the kind of the sexy telehealth part of it.
Yeah. Yeah. I mean, that Yeah, 100%. I mean, the magic is in that visit, is in that human connection that we're doing today, from all our homes and all our offices. It is truly special at Telehealth, but 100%. The part you don't see is the part after the visit. The med refill for the albuterol that they need at school, or perhaps, the reach out to a fax to their PCP, or that phone call, or, you're exactly mentioned that her FERPA and HIPAA compliant messaging to the counselors for that child to get referral. That's what, we just had a meeting today right before we talked about. That is our goal, and that's our success metrics. We talk about all this great technology, but we really need to talk on how we can bridge and work outside our silos, because a child who comes in and has COVID-like symptoms, that doctor has a quick, easy, protocol they need, but that school has a complete different protocol that they need for that child to get back into health. And so what may be successful for that doctor may not be successful for that school. And so 100% is how to get that communication, get that partnership, and most importantly, do what's right and get feedback. Are we doing it right? Are we doing it wrong? What can we do better? Because I think that's where we have that magic happen, and that's the success that we enjoy.
Right. Well, Rob, thank you very much for this kind of good big picture introduction. And I think it's time that maybe we get into the weeds a little bit with our two practitioners who not only have to talk about this, but actually put it to work day in, day out. Colleen, maybe we can start with you, Colleen Williams.
Absolutely, I'd be happy to. So just to kind of paint a picture of our school district, Kevin, I'm going to challenge your thinking a little bit. I know you were talking about services and supports for, our wealthiest districts, or our comfortable districts, perhaps.
Yeah.
San Bernardino City is a district that has more than 90% of their students free and reduced lunch. And so definitely many of our families, majority of our families, are relying upon our nutrition services during COVID times to continue to feed their families. And so Hazel Health has been a welcome partner for us in providing these supports for our students as well. But I know you maybe wanted to ask me a question first, perhaps.
Well, I mean, I can ask you about that. I mean, what was your introduction to Hazel Health? I mean, where did it begin? Did this happen before the pandemic? I mean, is this something that you've been working with for a number of years now? And maybe talk a little bit about how you were first introduced to them and how you kind of work as a partner, because that's a little bit of a different dynamic that you have with a lot of ed tech vendors or service providers, right?
Absolutely. So I can actually maybe show you and tell you at the same time, perhaps. So I have a couple of slides to talk through that, but definitely Hazel's been a partner with our district. We started very small with one school and expanded that kind of one school pilot to a few more schools. We are a district of just under 50,000 students with 72 schools. And so we often start with pilots to work out the kinks of things with partnerships. And so we definitely did that. And then pre-pandemic, we had Hazel services at 12 of our sites, and then launched into actually district-wide services and supports during pandemic times, so that all of our families could access Hazel at home and get a clinician or a doctor through any of their technology at home, including the technology that the district has released to them or they've borrowed from the district, including our laptops and Wi-Fi hotspots that we've given to families to utilize during this pandemic time. So definitely access across for from 12 schools to all 72 schools. So that's been an exciting kind of expansion of our partnership as well. So in looking at the services and supports, talking through where we're trying to go as a district, one of our encouraging pieces is that student wellness and support services is the name of our department. And it's kind of evolved into that. And it's been very, very helpful to understand that we are taking the pieces of social emotional health and combining those with physical health to kind of create this idea of wellness as a complete concept. It is part of our ethos in our district. What's really exciting is we have a community engagement plan. In the first iteration of that plan, safety and health and wellness were strategy 9. And now it's actually moved up in the second iteration into strategy 1. So looking at the idea that students' physical health and social emotional health is the foundation at which our academic success can sit on, and making sure that our students' basic needs are met, as well as their social emotional needs, and feeling safe on their campuses as well. So really wanting to, we've turned a corner as a district, from the Board of Education all the way through to say that meeting the basic needs of students is definitely the priority for us. So when we talk about wellness, we talk about it in, and I know that was a mouthful for you, about the multi-tiered system of support. Really, that's a way of just organizing our work, right? So that we have data points that we look at to determine what types of supports and what's missing and what's an opportunity for us to grow. As well as a key set of practices, and then our essential partners as well, which definitely Hazel is a part of that conversation. And so really looking at this multi-tiered system, if you see that pyramid on the screen for you, of physical health and mental health being combined, so that we can give the students exactly what they need before the academics come into play. So some of the services that you see there are really around how we've supported and developed all of our supports for students, and then what some of our underserved populations need to be just as successful as everyone else. And so we've really developed this sense of climate and culture at our schools, where we've taken what we started with way back when in the world of positive behavior interventions and supports, and integrated our restorative practices from the International Institute of Restorative Practices, as well as the trauma responsive work from SAMHSA, and then utilized all of those practices and services to facilitate social emotional health and development. And then lucky enough, as the director of what we call SWIS, for Student Wellness and Support Services for short, having the opportunity to adopt our health services team last summer. So this is definitely a work in progress, and we don't have it all figured out, but we have adopted them. So we have 22 registered school nurses, as well as 5 LVNs. And so their services across our district, and making sure that we're supporting all students in giving them exactly what they need to be successful. Go ahead, advance the slide for me. All right, so just wanted to share that we've provided additional supports during the time of COVID. And so making sure that we have a way of students to be able to access their school counselors, which is kind of our early intervention of mental health, as well as any medical needs that they have through Hazel Health. So we definitely share that work with our nurses, have that information. Our family engagement office is sharing that information. All of our student wellness and the climate and culture teams at the schools as well, so that we have many, many people, boots on the ground with the information for students and their families to be able to access these services and supports, which are so essential in providing those medical needs that our students have, where we have families who are scared to leave their houses and go to the doctor. And so this gives them a way to see a physician or a nurse practitioner and get those supports that they so greatly need. Yeah. So thank you for that opportunity.
Thank you, Colleen. That was really insightful. A couple questions. One thing I found from your presentation to be especially interesting is the combination of social emotional health or learning with the physical health, right? So, I mean, SEL, social emotional learning, has been a phrase even before the pandemic, which was kind of this theoretical topic that you would hear, that people would talk about in concept and be theoretical, maybe a nice to have that you would tack on to a piece of curriculum. Now that's been completely turned on its ear because of the pandemic. But really the physical, like the actual medical, I had never anyway, in my experiences, had those two kind of combined. When you look at the Hazel solution and the way that your mission is put together, all of those things seem to be combined, to be put together. Can you talk a little bit about this? I mean, is that intentional, or is that something just because those were the services that were provided by Hazel?
It's definitely been an evolution and a work in progress. We did start, like I said, with one school in this concept of the school that was identified was one of our elementaries, which is a bit isolated from the other areas of our city and definitely around kind of the main thoroughfare areas of the city, which then affected how they could access, right? How they could access those services and supports, and talk about, Dr. Rob was talking about medical provider deserts. Our city even suffers from sometimes grocery store and food access deserts. And so looking at bringing those services and supports to a community in need, where many of our families don't even have transportation to get from place to place. So it's quite an endeavor to be able to get to the doctor, and it may include a bus or two or three, and you're bringing all of your children with you. So it's a little bit of a large process for them to be a part of. And so when we've looked at how to integrate, and this has been kind of the work of this last year, Kevin, and I'm sure we're going to improve it as we go. But looking at this sweet spot of what we call wellness between social emotional learning and physical health, where it's great to have social emotional health and it's great to have physical health, but if you have them both, you're more capable of attending to the schoolwork and even just seeking and getting to a place where you become a happy, healthy community member, right? Our goal for our students is not only are they successful, but are they happy and successful in their personal lives as well as their professional lives? And so really making sure that they have all of the best advantages to be able to do that. And so really looking at Hazel Health is one of our physical health partners. And then we have some local partners as well that help provide case management for families and additional services that Hazel actually communicates directly with as well. So if there is a need for follow-up, once a Hazel Health provider is seeing a student, if there's need for follow-up with the primary care physician, they will reach out directly to that person. They've developed partnerships even with one of our major Medi-Cal providers. So about 80% of our students have Medi-Cal through IEHP, which is Inland Empire Health Plan. And so Hazel talks directly to them as well, which helps us in making sure that we're meeting the needs of our students directly.
Great. Well, Colleen, thanks so much for your presentation. That was great. And we're going to follow up a little later with an overall Q&A with other questions that come in from the audience. I'll just give a reminder to the audience that if you have something, either a question or opinion or a thought, please enter them in the chat or in the Q&A, and we'll enter it into the conversation here. And with that, let's move to Renee. Renee, thanks so much for joining us today. Maybe you can give us a little background of your district and where you are DP during the pandemic.
Yeah, it's definitely been a different type of struggle that we've had over the last year. We're making through it thanks to Hazel Health and our partnership with them. I've been working with telehealth for many, many years. I like to say I was doing telehealth before it was cool to do telehealth. I was one of the first nurses in our district to use telehealth to give our students access to, at that time, it was just physical care, and now we got mental health and physical care. And so it's been quite of a challenge for our district. If you'll go to the next slide, I'll kind of tell you a little bit about our process and how we went. We have about 55,000 students, about 65%. Now it's really more up to about 70% are economically disadvantaged. And we also have a large population of English language learners. And with that comes with additional stresses that our parents face. And I'll go into a little bit more about what some of those things are. But if you look at our graduation rate is quite high for the difficulties that we face. It's about 94%. And that didn't happen by accident. We believe that every student can achieve. But just because we believe it, we have to make sure that it will happen. And one of those barriers are, we have a lot of students that have mental health issues. We have a lot of students that have health conditions that require that little extra care to get them in the seat learning every day. And that's how we look at telehealth, is helping us get those students in those seats. If you'll advance to the next slide. Now, with that being said, I know we talked about, a robust counseling service program, and we do have that. We have virtual counseling. We provide parent education. We have responsive services that address immediate concerns, and they provide counseling. We did start that social and emotional learning in every single grade level in our district, but you got to realize you have to kind of start real early and have those kids have those tools. So a lot of our students that are older don't have those tools that they need to be able to cope in today's society. So we're on the right path with social and emotional learning, but it will take us a while to get there. And so that's another thing that we use telehealth for. If you'll go to the next slide. One of the things that I want to talk about is the impacts of COVID-19 in our district. Even before COVID-19 hit us, we were at kind of a precipice we were losing students. What I mean by losing students is they were not graduating. They were, so that we had a lot of dropouts over the last couple of years. We had a lot of suicidal students. And we had that robust counseling program, but it's not enough. And I think the slide that Dr. Rob had kind of hits the nail on the head when he said 20 million people don't have insurance or don't have access to, don't have access to medical care or appropriate medical care. We don't have 20 million people maybe that are uninsured. But I think what a lot of people do is they throw let's insure everybody and this will solve the problem. Mm-hmm. A lot of our students have Medicaid, but yet they still don't have access to healthcare. So when you're looking at access, you're looking at transportation. Now, it may seem simple to us to get on a bus and, if this parent really cared about this child, they'd get on a bus and they'd go see a doctor. It's not that easy to do. Maybe they don't have money for the bus. Also, they're not open at the right hours when the parents can actually access the care. So there are a lot of people that can't go out at night to access the care, or the doctor's offices are not available at that time. There's not enough providers, like you were talking about those food deserts and medical deserts. We have quite a few Medicaid providers in our area, actually in Garland area, but it's still not enough for the number of students that are on Medicaid. So what would happen is you'd have a routine, I hate to say routine, but an eye infection, just say. You could go to the doctor, get on medication, return the next day to school. But it was taking 4 to 5 days to get these kids back in school because it was taking 4 to 5 days for them to access the care. We don't have to worry about that anymore. We can get that child seen that day, next day they're in the seat. Also, what they do is it's not only about getting the care immediately, but it's about finding medications that are affordable. So a lot of doctor's office, you go to the doctor's office and this might be the best medication, but who can afford $120 for a medication? They can't. So it's about looking at the whole entire child, their family, not only their family, their access to medications, their access to healthcare. Another thing is parents can't take off the time off work. And I want to give you an example of something that still sticks with me to this day about telehealth and how we can, what I call save the kid. And when I call save the kid, making them well-adjusted, ready to go out into society by the time they leave us. We had a 5th grade student that had chronic absenteeism. And no matter how many times we reached out, we had the principal, the counselor, everybody reaching out to this mom and saying, this kid has to be in school. Sweet, sweet kid, really wanted to succeed. But he'd miss at least one day a week. So he wasn't getting all the education that he needed. So we spoke with mom, we tried everything we could. So I said, well, let's do this. Reached out to Hazel and said, hey, let's do a well visit on this kid. So we got mom to sign the application to do the well visit. And they did the well visit. And when they do a well visit, they're looking at everything. They're looking at the family aspects. They're looking at the social aspects. They're looking at the mental health aspects. And what we find out is this poor little 5-year-old, 5th grader was staying home to take care of a 2-year-old when mom could not find childcare. Now, do you think this mom was going to come and tell us about this situation? No, not because we're the enemy, but sometimes they view us as an enemy because we're the ones that are constantly calling saying, hey, you need to get your kid in school. We're the ones that send the warning letter. We're the ones that send you to court. We have to. It's the law. Truancy is against the law. But at the same time, we couldn't help that mom. We couldn't. We couldn't until we realized what the problem was. And the only way we found out the problem was because Hazel, an outside entity, reached out to this parent and said, let's talk about what's going on. So once that was done and mom realized, hey, we're not going to call CPS on you. We're going to help you solve this problem. Helped her get access to daycare, helped her get on food stamps so she could use some of that money towards daycare. So those are the high level things that telehealth can do. And I've seen it over and over and over again. And we get into COVID. The impacts of COVID is just something like I've never seen. We have more mental health issues now than we ever had before. And we've had it before, but it's almost doubled. The amount of students that need help. One of it is you have a lot more academic stressors. Some people do very well at home, but some people don't. We've been very lucky that we stayed virtual for such a short period of time at the beginning of the school year and then were able to come back. But there are still students, because of their health conditions, that cannot come back to a campus. If they got COVID, it's a matter of life and death. So you lose that lack of motivation. You lose that connecting with teachers. Sometimes a teacher is the only person that smiles at you all day. So you lose that. Also with the social isolation, the loneliness, not being able to hang out with your friends, separation from a lot of your mentors. And then the people at home. We have so many people, like Colleen said, that have food uncertainty. They don't know where their next meal's coming from. So if you're hungry, you're not worried if you're going to be able to pay your rent. Is school going to be a top priority? Is health going to be a top priority, either mental or physical health? Probably not, because if you look, I don't know if anybody has ever seen that Maslow's chart, saying all the different needs that people have, and a place to live is real high up there on the list. Seeing a doctor for a chronic health condition is probably a little bit lower. And then there's a lot of toxic home environments right now. Parents are stressed, students are stressed, and teachers are stressed. I'm stressed. So we're just having to deal with that. And I don't care how many staff we have, we will never have enough manpower or expertise to solve all those problems unless we reach out to someone else to help us with that expertise. Yeah. And so that's why I'm a big proponent of telehealth, is to get those kids where they need to be so they can go out into society and function appropriately. So.
Renee, really powerful stuff right there. And actually, while you were speaking, a question came in from the audience asking, how did you engage that parent in the wellness visit? How did you encourage her to be more open to getting support? And I guess I have a question on top of that. Was that done because we're in COVID? Was that done in a remote way, or was that in an in-person way?
What we did, we had started Hazel before we went remote. So we started pre-pandemic. And what we felt like when you leverage your telehealth, you say to yourself, you make goals just like you would anything else. And one of our goals is, how can we leverage telehealth to help with our chronic absentee students, whether it be health related, mental health related, or is there some other social thing that's going on in the home? So when we were looking at promoting our telehealth services, one of the things that we promoted was a well visit. So anybody who wanted a well visit could have a well visit. When you take out the health and the mental health, and you're just talking about a well visit, it's just having the computer in front of the child, and it's a free for all. They're able to voice everything that's going on, and they require very little prompting. And so you find out so much in those well visits that you never knew about. So it's how you want to work with a telehealth provider to leverage it. We're fortunate that Hazel, for us, we gave them the goals and said, these are our goals. And they said, okay, this is what you need. We're going to meet those needs. So that's the kind of partnership that you need, because every district will have different needs. So we didn't have to have any buy-in for the parent. The parent wants what's best for the kid. It's easy to get that kind of parent buy-in. And then once they took out that, oh, I don't want to tell the district something, and Hazel was able to step in and bridge that gap, then it was easy talking with the parent. Mm-hmm. Parent had a misconception about what we were willing to do to help their child. And so we got rid of that misconception, and we've done it over and over and over again.
That's great. Thank you. Colleen, can you talk a little bit about how you've used Hazel in response to the COVID-19 situation? I mean, were there particular ways that you used it differently than you had before?
Absolutely. So pre-pandemic, I don't know if that's going to be like a new term for us, right? As the future will only tell us. So pre-pandemic, definitely had those 12 schools that I had mentioned, really utilizing Hazel Health on campus, where students were going to see the health aide or the nurse, and meeting with a physician or a nurse practitioner virtually. And then provided over the counter medications right there if we had permission from the family, if that was appropriate. Hazel can also call in those prescriptions if something was needed, and they could identify those needs to a local provider of the parent's choice. And then encouraging families to reach out to their primary care physician if that was the most appropriate direction. And so definitely during COVID, never let a good crisis pass you by as an opportunity. And so we definitely have refined and improved our skills, and taken basically all of our services and supports and transitioned them into the virtual setting. And so for Hazel Health, that Hazel Health at Home, where families have access to that medical provider from their household, which has never been the case pre-pandemic. And so they can definitely access those medical providers right there and then. And in conjunction with our IEHP navigator system, which is their Medi-Cal provider, and in providing those supports. And even ensuring that we have, to Renee's point, we have a huge increase in our social emotional needs of our students and our mental health needs of our students. And we have a few indicators of that and data that we track on a monthly basis looking for that. And so even have repurposed and developed a stronger partnership with our district police department. So where in the past they were more around enforcing the rules and the guidelines at school, and definitely keeping the school site safe from any contraband or weapons or anything like that. We've transitioned them where when we have an alert of a potential self-harm case and it's after hours, because our police department is 24/7 and it's specific to the district, that they have been able to perform welfare checks on our students and definitely have been responsible for saving lives as they've gone out there, and students are more imminently in danger of self-harm than perhaps previously known. And so making sure that we're building systems for and preparing for when we return, that the new normal is going to require a whole lot more support. One of our findings even is around immunizations, and our families are not all of our families are accessing their providers to get immunized with their regularly scheduled immunizations. And so making sure that we're providing education to our families in that service and support, as well as some mobile clinics at some of our school sites so that they can go right to their local school and get their required immunization, so we can make sure that they're prepared to return to school when schools are open. And then in terms of Hazel Health and making sure that our families know about it, know how to access it, Hazel has developed a robust partnership with us in sharing that information. We've done multiple trainings with different departments and school sites in sharing the information out to staff to have an understanding, so that they, in turn, when they come across a family that is in need, that they can share that information and help those families access the Hazel services. We've done family webinars with our family engagement office, where families can come in and understand what is this thing, Hazel Health, that they've never maybe experienced a telehealth program before. And even done mailers and flyers out to families, and all the information is on our district website, so that families know kind of at every avenue where they can access a medical provider, even without leaving their house. So it's been a fantastic opportunity for us to share that and have Hazel as a partner.
That's great. That's great. Thank you for that. And actually, as you're speaking, another question from the audience. I love it. I always know that we're having a robust conversation when you actually get questions in from the audience. But another one for you, Colleen, about asking whether you have a designated space in your schools for telehealth primary care services, and who manages that? What is the role of your nurses with such services?
Great question. The logistical question, which I love. So most of our schools have what we call a health office or a health aid office. Because I have 72 schools and 22 nurses, you can do the math and know that my nurses don't live at one school. And so they do have multiple school sites that they support and provide intervention for. So really the person who is managing the space and the access is our health aide at our school sites, which is a classified position. And that person those people have all been trained at our school sites to support that. But what's really great about Hazel is it's a very small footprint, and I would have to defer to the Hazel team on exactly how big it is, but you access through really an iPad. And then for the schools, Renee's got something I can tell. And then for the schools, they have a locking cart where the over-the-counter medication is. And that's really as large as the footprint is. It's not that you need a whole separate wing, although we'd all love to have a wellness wing. I'm just putting it into the universe in case that can happen. But we have very, very small sites that have found space, a little tiny office to the corner. Or we have sites who have wellness, have recaptured some of their classrooms as a wellness space, and have maybe a whole classroom size space for that. The challenge is making sure that it's confidential space, especially as the kids are older, because they don't necessarily want to talk about the reason why they need a Hazel visit in front of other people. So making sure that that's a confidential space, that they can have that conversation has been the most successful.
Yeah, actually, maybe Renee, if I could ask you to talk a little bit about your logistics in the same sense. Talk about your setup with nurses and designated spaces.
Basically what we do is we do have health clinics as well in every one of our campuses. And what we do is, if a lot of the high schools and the middle schools will have a separate room that the student can access Hazel in. And then in elementary, sometimes what we have to do, if we don't have any space, they'll do it in the clinic, but they'll just shut the clinic down for a short period of time. But we do have a designated space in our high schools and middle schools. And
Okay.
it's not a lot of space that's needed. It's very, very small.
Interesting. Okay. And again, I mean, another question, Renee, that came in for you, that the fact that you mentioned the wellness visits, what are some of the more common healthcare needs that you find and issues that you see or route that you route to Hazel providers? Does everything go to Hazel?
Almost everything can go to Hazel. That's what I love about Hazel. Almost everything. Even sometimes some minor injuries, they'll go to Hazel and they'll look at the swelling and stuff like that. But the majority of what we use it for right now is we have a large population of asthmatics. Of course, Texas, everybody has allergies. A lot of allergies, a lot of asthma, asthma type management. They can't get into Children's, which is our main hospital that has an asthma education program. So we had to create our own asthma education program. But no matter how much we educate someone, if they don't have access to the medication, it doesn't do us real, any good. So what we do is we call Hazel and say, hey, they can get into this doctor 2 weeks, this specialized program, but I need an inhaler for the student. This is the only way this kid's going to be allowed or able to access their education. So that's a big use there. Also, we use it a lot on our diabetics. Sometimes we'll have I don't know how many times you tell them as a nurse, you need to do A, B, C, or D. Mama tells them you need to do A, B, C, or D. They just don't listen. But if Hazel comes out and says you need to do A, B, C, or D, then they're more apt to do it. So that's another way we use it. And then we also use it for your routine, little skin infections, so your routine stuff, but also more higher level, maintenance type health conditions.
Gotcha. Dr. Rob, a big picture question back at you, I guess. How are doctors chosen for the Hazel Health program?
Very carefully. We're a service, this model is flipped. When you step into a doctor's office, you have the doctor. This model is completely different. We're guests in the nurse's office and guests of the school. And so I always like bragging that we're high concierge medicine to the children and families who need it the most. When people say, gosh, I love it at my school. And I say, well, this is what we really enjoy doing. And so really we select and handpick and hand train our providers, because telemedicine is a unique field to different field. And to know that this is a different role, that these are families that at times, as Renee and Colleen mentioned, really don't access care. This is our one chance to make that impression, and one chance to, again, also abide by HIPAA as well as FERPA rules, because we always want to we have a saying, when always do what's right for the child. And so we can do that with the right partnership. And of course, but this is unique. This is unique for sure. This is not your typical office.
Yeah. Another question that came in to ask kind of what's the financial setup? How do the finances work in terms of the relationships between districts and Hazel? Can you kind of give us a general sense?
At this point, we're working with every plan. We work with every district. Let's put it that way. Everything's different, and as we mentioned, as you can hear, every clinic, every school and plan is different. So, for those that we obviously are working with every plan in every district and every county for those Medicaid plans to make sure we are at no cost for those families. We also want to work with those schools that have equitable care and our partners that say, I want every child seen. And again, we don't close for any child. Our doors are open, and we are working to be really to make sure that we have the right structure in place for each school and each district.
And I assume that you find districts in various states of progressiveness when it comes to using telehealth. I mean, are the majority still like not using it at all? I mean, is there? Give us a little bit of the spectrum. And for folks who are on the call, maybe give some advice to districts who are at step one, and then maybe districts who might have already kind of dabbled in it a little bit, but really need to take it to the next level.
Yeah, I think as Colleen and Renee mentioned, I think one mentioned that, you know, these are our needs. They come to us with, these are needs. Can you deliver on our needs? You know, when we first started, and we just sent in a paper for publication on our first pilot programs, that, you know, we listen to our schools, like, how can you help us with absenteeism? How can you help us reduce chronic absence? And so that's what we looked at, and we looked at the fact that you know, in our first pilot programs, we saw in the school, all the Title I schools that we were in California, we saw a reduction in chronic absenteeism, because that's what schools need. They want their children, yes, they want their children healthy, and that we know that, but what is the metric? How do you define health? And so really, I think really listing out your needs, what your wants, what your expectations are really the great first conversation step to have with any telehealth company, to say, this is what we need. Can you help us with this?
Yeah. A question, I think this is for everyone on the panel, but maybe we'll start with you, Dr. Rob, and then Colleen, Renee, you can make comments. Do you also work closely with students with severe disabilities? Talk a little bit about IEP meetings. Do those sort of dynamics come into play when Hazel Health is involved?
Yeah, you know, in the meetings, as Renee mentioned, in the meetings, when we say, what do you need? What are your needs? We go through what's called the district health protocols, everything from pink eye to a suicidal patient. We go over every list to make sure we're in alignment, because again, we are guests in that school. We want to follow those protocols to a T. We pride ourselves on that. The next step is when we have new, kind of like new asks. Can you do IEPs? Can you do these things? We say, let's partner and find out. We had an EpiPen program because one of our districts said, we don't have EpiPens in our schools. How can you help us? And so we partnered with a great company, and we're able to make sure that we can get those EpiPens for every school, so that if a child has a reaction. And so that's it. I mean, you know, we're building this as this is new, and every district is different, has different needs. And so we sit there, we say, what do you need? What can we do? And let's be honest, I'm going to say that nothing, we've had conversations where there are things that we can do, and I think there's things that Thomason can't do. And so we have those conversations, we come to a great success. And, you know, as I think the great opening line is like, what did you have before, Hazel? And so that's really where we realize, okay, this is where we can definitely get to here. And I think I'll finish with equitable care. I think when people think equitable care, I think of like, oh, I want to get to here because this is what the standard is. In equitable care, we're getting people from here. We need to get them here. And I think telehealth has a great ability to get to the top, but also really help with health metrics and help children be better.
Great, thank you. Renee, have you had experiences with students with severe disabilities, or going through the IEP and maybe even some special ed situations?
We haven't had Hazel Health actually go into like a SPED meeting before. But what they do is, if a parent reaches out and they're having difficulty getting a certain level of care, that's how you can help Hazel Health. So when you make that IEP goal, to make it that you can meet that goal. So say you have someone who has, like, you know, food allergies, and you need to make sure that they have an EpiPen. And part of their, mainly for 504, one of their goals is that they have access to medication. So we make sure that that parent has access to medication, so that way we can meet that goal. So those are kind of how they work with special ed students. They don't go in there and write the IEPs. You know, they don't provide the tube feedings and the catheterizations. They can't do any of that, but they can certainly help bridge that gap and find their resources. We have used them to find resources out there for these special needs students.
Yeah. And Colleen, any thoughts or experiences with that, to that degree?
I would agree with Renee that our nurses, our registered school nurses, are the people who are attending the IEPs and providing that service, should it be appropriate for a medical need of a special education student. But definitely the communication between our nurse and Hazel Health occurs. And so looking at how services Hazel may have provided to that child, we actually list a Hazel visit in our student management system, our student learning management system, so that we know that there was a service provided of some kind. And so we can definitely look back to see what that service is and see if it's something that we can reach out and provide more preventative care for the family based on the need that they had when they reached out to Hazel as well. And then just a I would be remiss if I didn't share a quick little story with you about a family with Hazel, and that a student had been seen at one of the school sites when we were physically open pre-pandemic. And then the student had large amount of weight loss and pain in their joints. And so the parent utilized Hazel Health at home and accessed actually the same provider provided support for this student both times. And Dr. Rob, you may have some additional details to pitch in here with me. And based on the change over a very quick amount of time, the Hazel provider convinced the parent that it was necessary to take him to his primary care physician. She didn't want to go because of COVID. She was scared that, they would catch COVID, and it was just better to stay home and safe. And so with the kind of the promptings and recommendation of the Hazel provider, the family went to their primary care physician. And it was discovered actually that the child was diagnosed with leukemia, and was immediately put into treatment. And so because of Hazel, it was like, this is a red flag going off, and we really need to get him some physical support. And so doing well now. And so that treatment would not have occurred had Hazel not gotten involved. But Dr. Rob, are there extra details you wanted to add there from the provider perspective?
That story warms my heart, but yes, I mean, and it was the same provider, because we know that there's a continuity of care to be culturally, linguistically, and also if we've seen the kid before, can we building an app where you can actually connect with those parents again? And so yes, I remember that visit very well, and our provider knew that child at school, knew he had been sick and not doing well, but connected with mom. Typical messaging to us at night when a parent has that at 8:30 at night, when the parent's like, finally all the noise quiets down, and then they're like, oh, I have to take care of this. And then all the rest of the flood of, well, I can't. We believe in our care, we believe from the visit to the end of the visit. And that requires not just a visit, but the follow-up, the connection to the primary care, the making sure that we have the warmest handoff possible. So that resulted in a phone call to the clinician. I remember even the father bringing the child. The mom's like, well, I have to work. Dad doesn't know much of the history. And I think we prompted the doctor and saying, when you see dad, call mom, because mom's going to tell you more than dad is, because we wanted to make sure that this child and all the concerns that we had and mom had were well addressed and not brushed off. And and then following his course and making sure every once in a while checking in, is there anything we can provide or any questions, because this is a whole new journey for this family. And so providing that support, and again, communicating that back and forth to their medical home so they know that the child is doing better. And we're just really glad to be at the right place at the right time.
Amazing story. I see that our time is just about up, so I'm going to wrap things up here. If you submitted a question that we didn't get to in the Q&A portion, someone will definitely follow up with you directly to answer any questions or concerns that you may have. I'd like to thank our presenters today for not only informative presentation, but really just kind of a very powerful presentation to see how effective this technology can be. And thank you all for the work that you have done over the years and that you continue to do for students. It's really important, and it's just just a thank you from all of us. And for the audience, as a reminder, you'll get an email within the next few days that contains a link to this recording along with the slides. Thanks again, everybody, for participating. I knew the toughest part of this conversation would be to end it, as we could go on, but there we are, and hopefully we can continue it online into the further. Thanks everyone for watching, and have a great day.